Thank you, on mine and my co-author's behalf, for allowing me to present to you our study titled A Pilot Pediatric Emergency Medicine Knowledge Needs Assessment in a General Emergency Department. The majority of pediatric emergency department visits in the United States occur in general emergency departments. Several studies have found the care those patients receive to not be supported by current guidelines or evidence. Pediatric acute care guidelines are mostly generated from studies in pediatric specialized settings, and their integration into clinical care often takes over a decade. Collaboration between pediatric specialized emergency medicine departments, where research is often conducted to generate evidence-based guidelines, and general emergency departments who provide the majority of pediatric emergency care, would bridge those practice gaps. An integral part of developing such a collaboration is a knowledge needs assessment. The aim of that assessment is to determine how clinicians access information, what information is most relevant to their clinical practice, and how they wish to receive this information. There are very few pediatric emergency medicine knowledge needs assessments conducted in the United States. Therefore, our aim was to assess pediatric emergency medicine knowledge needs of general emergency medicine providers in a non-pediatric specific emergency department, including methods of accessing knowledge and topics of importance to enhance clinical care. We conducted a pilot survey study of advanced practice providers, residents, and attendings in the Department of Emergency Medicine at Edina Regional Medical Center in Chillicothe, Ohio. We developed a 22-question survey based on previous knowledge needs assessments conducted by the Translating Emergency Knowledge for Kids TREC network in Canada. The survey was validated by faculty at Nationwide Children's Hospital with training in general and pediatric emergency medicine. A total of 18 surveys were completed with equal numbers of male and female respondents, and most respondents being between 20 and 30 years of age. 13 practitioners had been in practice between 1 and 5 years, and 12 of them had only worked at Edina Regional Medical Center for that time. All respondents reported using websites with a medical or health focus as the most frequent method to find information in order to care for children in the emergency department, spending on average 1 to 5 hours weekly gathering that information. Attendings were more likely to use a laptop or desktop computer to access that information, while residents and advanced practice providers were more likely to use a smartphone. All respondents found accessible, evidence-based clinical practice guidelines and information regarding novel diagnostics and therapeutics in pediatrics as the most relevant items to enhance their clinical practice. The diagnoses of highest priority were pediatric trauma, sepsis, and neurological emergencies. Respondents rated talking with colleagues in face-to-face conferences and meetings as the preferred method to make new information available to them, followed by mobile applications and printed summaries. In conclusion, general emergency medicine providers need timely and accessible, evidence-based information to enhance their pediatric care, particularly relating to pediatric trauma, sepsis, and neurological emergencies. Our findings will help guide methods to drive the dissemination and implementation of research-based, evidence-supported information in the acute care of children, regardless of treatment setting. Thank you.